fine. This is Deliverance TV na karibu sana. You know, it is a very serious issue when you talk of medical issues. It has been disturbing everybody from youth to older people, and that's why today on Youth Care Unit we bring Dr. I think that will be a bit tricky to name, so I give him a chance to introduce himself. My name is Sasam, and this is Youth Care Unit. Dr.
Sam, don't be scared pronouncing my name.
I'm scared to pronounce their name. I think it's quite tricky.
Well, my name is Dr. Narinder Singh Thethy.
Narinder
Singh Thethy. And our clinic is very near ATG Deliverance Church.
Yes.
We are just next to ATG.
Yeah.
And the name of the clinic is the Brain Dynamics Clinic. And we have been practicing here. And today we will be talking about a very different type of medicine.
Yeah.
It's called homeopathic medicine.
Yeah.
So homeopathic medicine, I can just talk in a bit
maybe
brief.
you can tell us what homeopathic is.
Yeah.
Maybe.
It's a different system of medicine. Homeopathy is not conventional medicine, and it's not herbal medicine.
Yeah.
It's different branch of medicine. Like bachelor's degree in homeopathy, it's 5.5 years, which is almost equal to conventional medicine. And MD is further 3 years. It's very much scientific, and it's practiced in so many countries. And people like the medicine because it has got no side effect. And the medicines are very small in size. Medicines, they look like the size of mustard seed, comma fertilizer. You know, very, very small, tiny ones. So they are sweet as well. They are not bitter. And homeopathic medicines, they work on all different type of conditions. Hata kama ugonjwa ni ya zamani sana, still it can be treated and it can be cured as well with homeopathic medicine. And if you see somebody has been tired of taking medicines because they are not getting healed, I think for those people they should try homeopathy, and it works.
So it's like it's a better option compared to the rest.
I will not condemn other medicines because we complement each other.
Okay.
Because even conventional medicine, it has got its limits. Homeopathic medicine has got its limitations. There are some conditions, some medicines don't work, and then the other medical system can work on those conditions. So I don't want to say who is superior than which one is superior than the other one, but any medicine we have to work together with the conventional or herbal or homeopathy, whichever is working. End of the day, our mission is to help the suffering people so that they are not in pain, they are not suffering. So homeopathy is a very good system of medicine. It works and it helps. And you know, if I can talk about chronic ailments, sometimes people have been taking medicines for years and years, and they are told
This is incurable.
Incurable.
Yeah.
Or you have to be on those medicines for the rest of his life. For those type of patients, I will advise that they should try homeopathy, and maybe they don't need medicine for the rest of their life. So they can be cured.
So Dr. Narinder, you're telling me if maybe you try homeopathic and you have these diseases, it means that you will not take them for the rest of your life. It's like you give them periods.
Yeah. Okay. Some conditions, you know, if you take medicines like a couple of weeks or couple of months, conditions, patients feel much better, and they don't need really, they don't have to take medicines for a long time, because homeopathy is not a habit-forming medicine, and it works to remove the root cause so that somebody is healed for good, and they are working, and we have been having our clinic since more than 15 years in Nairobi.
Nairobi.
Yeah, and we feel good when patients are feeling better. We feel satisfied as well that our work is really it helped somebody. So that's what we are trying.
So Dr. Narinder, how is the response? Of course, I know you have told us you have been having a clinic for 15 years.
Yeah.
So how has been the response? How has been your patients be responding? Do they like it?
Patients who come to our clinic, they have, people go to alternative medicines after trying so many hospitals.
Several,
And when they have been trying and they are not getting better, they want to try alternative medicines. So homeopathy, they come, and we have seen people, they come, they bring their family. Means when one patient is feeling better, obviously it goes to other people as well, the same message that these medicines, they work better. And people come, they improve, their condition improves. And even if somebody is having 10 problems, 20 problems, people have got very complicated problems sometimes. And when they are treated with homeopathy, all the problems, they start reducing one by one. And they feel better. And
so if I can ask Doctor, I know my viewer and I too would like to know how different is homeopathic maybe from the rest?
Homeopathy, how it is different. In there are different colleges in India and other countries as well. Definitely there are colleges and universities for a study homeopathy. And how it is different, number one, the way I said, okay, the medicines are very small in size, they are sweet. In conventional medicine and herbal medicine, as you know, some that if one tablet is not working, people, they take 2 tablets. If 2 are not working, they take 3 tablets. Means they increase the medicinal substance to increase the power. But in homeopathy, it is completely different. Okay, even in herbal medicine, if 1 spoon of herbs is not working, you boil 2 spoons of that medicine, that herb. But in homeopathy, we reduce the medicinal substance and it becomes more powerful, like dynamization of the medicinal substance. We use, our medicines are also just like conventional medicinal substances. They are made from minerals, they are made from metals, they are made from herbs as well. So it's a completely different study, and the medicines are tested on human beings. Our homeopathy is not tested on rats or maybe animals. Our medicines directly tested on human beings, so we know exactly which medicine can work on which condition. It's completely different.
So if I can ask Dr. Narinder, which are some of the countries that maybe practice homeopathy?
Okay. Homeopathy, it started from Germany. From Germany, in India, it is really very advanced now. In India, even Ministry of Health, they employ homeopathic doctors. Ministry of Health has opened homeopathic dispensaries, homeopathic hospitals. Homeopathic dispensaries, people, they're in a district hospital, even government hospital, you will see there is a doctor of conventional medicine and there is doctor of homeopathic medicine. Government provides multiple options. for the people to choose whichever medicine is working on them. Government is providing these type of services in India.
That is in India.
In India, it is everywhere, even in Pakistan, even in Switzerland, even in Germany, even in Italy. You go to UK, I mean America, Canada, it's all over. Homeopathy, it's known. Okay, according to World Health Organization, homeopathy is the second most used medicine in the world.
From
After conventional medicine. So conventional medicine is used a lot. After conventional medicine, it is homeopathy used by the people, and it's second most used medicine. So it's quite known in so many countries. Yeah.
So, Dr. Narinder, this is, I can say, is a youth show, and you know, one of the medical problems that has been of challenge to our young people is our mental problems. So, Doctor, I would like to know, when you practice homeopathic, how do you deal with mental problems, and maybe you can name some of them.
Yeah.
Yeah.
Okay, mental problems. These are medical conditions according to us. You know, there are people, they have got a lot of anxiety. Anxiety means somebody feels feels anxiety, his heart starts beating fast before an interview or before coming any type of work he want to start. Before that thing, he can start having anxiety. He becomes anxious, he becomes panic. So for these type of panic attacks, we have the medicines. After the treatment, people, their heart becomes normal. They don't start beating very fast when the way it used to be before homeopathic medicine. And also some people, you know, because of anxiety, they start sweating a lot. So when we treat them, their speech does not tremble, sweating is not there, and then they don't forget they wanted to talk. So anxiety, it's a very complicated problem. You know, if somebody who is very educated even, and if he is suffering from anxiety, if he is called for an interview, you will see he is not able to express what he can do, how good he is, how he can perform. So they fail. I mean, they can't succeed if there is anxiety. Also anxiety, you know, there are children at school, when in the class even, when they have anxiety, even when teacher asks any question, they feel anxious, they cannot answer even the question of the teacher. So anxiety we treat from small age of children to elders to youth as well. So it is a medical condition for anxiety, panicness, panic attacks. And you know, there are some people, they sleep and they wake up around midnight because of the anxiety attack, and they panic. They have to do a lot of things to calm themselves. So those type of cases we have treated, and very successfully. Anxiety, we can finish anxiety with homeopathy. So that is anxiety. Another thing is like conditions like bipolar, schizophrenia. We have got very good medicines for bipolar and schizophrenia, and we have treated so many cases where extremes, people become angry, they become violent. With homeopathy, the anger, the violent condition, it cools down. And also another condition is suspicious behavior as well. You know, if husband wife, they have got suspicious behavior, even somebody talking to another person, your partner, your better half, who feels that you have got other relations with somebody. So even suspicious behavior is a medical condition, and we have treated so many cases whereby they were almost going to divorce because of their misunderstandings, and they are very much okay after the medical treatment. And we don't give counseling. We want to know how somebody is suffering, and then we give the medicine, and it works. And
I think that will lead me to a very sensitive question, doctor. And I will ask, you know, here in Kenya, we believe that those are just normal behaviors. And we believe that you can't cure behavior. You know, if I lack confidence,
yeah.
that we know is very normal. But according to you, you're telling me that is treatable. So how do you deal with Kenyans and maybe try to fix them and show them that it is curable?
You know, we are all human beings.
Yeah.
Atakamani, somebody from Kenya, ama USA or India, we are all the same. I mean, just the same. And the people have same type of ailments everywhere because we are human beings. And confidence lacking also. We have treated so many cases. They have fear of failure. They will not succeed. They can't succeed. They have tried. So they believe they will stay like that as a failure. We have the medicine. And when you know what happens when a patient comes to the clinic, to our clinic, we show them these are your medicines. They can read themselves. And then we select one medicine for his confidence, and they become okay. You know, there are some people, they cannot talk on a stage. When they go to a stage giving a speech, they start trembling because confidence is not there.
So that is not normal?
It's not normal, definitely. Because when you have confidence, you can deliver your message, you can give a talk. Yeah, and more boldly, not feeling shy or not having heart beating fast. So there is need of medicine for these type of treatment, and homeopathy can work on that very easily.
So doctor, when maybe you are treating like those behaviors, do you only give medicine? Is it like a dose, or do you maybe talk to these people? How is it done? Because you know, according to us, we don't give any counseling to such people, such cases, because we are not, number one, we are not trained for that. We only know about the medical side of the human behavior, and even fears. You know, fears is a medical condition. People believe fears, people have got, it's natural having fear. But according to me, fears are medical conditions. You know, there are people, they are scared of even walking in the street. They feel fearful. They cannot cross a road. People have fear even from a high place. They cannot look down from a rooftop. So even fears are medical conditions, and we give medicine and it becomes okay. And when we say about somebody grown up, why somebody has fear, because there is no medical test which can show what is the problem behind fears. You go to any lab, they will say this person has got normal brain. So according to us, let me give you an example. Have you seen sometime there is somebody who is watching TV? On a TV, if they see a snake coming, when they see a snake coming, they switch the channel to another station. I mean, they can't see a snake. There are some people, they are scared of cockroach even. There are some people, they are scared of cat. There are some people, they are scared of darkness. You will see somebody, if the light is not on the other room, they can't go. So there is fear of darkness. So according to us, somebody grown up who changes the channel of the TV just because
there is a snake on the TV, that is a fear. And we have different medicine for snake fear, we have different medicine for cockroach fear. So it's all medical condition. So I don't think this person, he knows from TV, this snake will not come out to bite him. But still the fear is there, isn't
So you
it?
can't advise counseling maybe on that case?
Because he knows already it is a TV, it's just a picture.
Yeah.
So you can't, he does not need any that type of advice or counseling for on these type of conditions. I believe when we treat such cases, they stop having fears. Fears they finish. Yeah.
And maybe if we can talk of depression, you know, it's very normal, especially with young people.
Yes. You know, depression, conditions like bipolar, because lifestyle nowadays is very stressful.
Yeah.
You know, people have got financial problems, people have got unemployment is there, problems of ambitions, a lot of people, they have got very high ambitions. When they can't succeed, they go into depression.
Yeah.
They fail even in their maybe college or school. You know, small failure, we have seen people commit suicide as well.
Yeah.
So according to me, there are medicines for depression, there, and it can be treated. We have got many cases we have treated for depression and for schizophrenia, bipolar, very successfully. So even depression, it is treatable. You know, most of the people that come to us, they have gone to so many psychiatrists and psychologists for different services. But with the homeopathy, it's completely different. So I think we should work together with the other systems. And there is no reaction of homeopathic medicine with conventional medicine or any medicine. It can be taken along with the other system of medicines. So there is no reaction at all. So we are trying and we are happy.
So when you say they can maybe be taken together, maybe with these other
Conventional medicine.
these other medicines, how should it be done? Because I think there must be a guideline. Maybe this is how you take this medicine and this is how you take this one.
Usually what happens, number one, patients who come to us, they have been trying those medicines. And after starting our medicine, when they feel the changes, they know which medicine to take and which to stop. Isn't it? Obviously. When you know another medicine somebody has been taking for 5 years, has been taking for 10 years, not working, and this medicine in 1 or 2, 3 months time, there is great improvement. People like...
so you check on the progress.
Oh, obviously. Even the patient himself, he can know that the medicine, the health has improved. Physically
these
and
medicine
mentally.
are working and these are not working.
Yeah, he has to decide. It's obvious, because somebody who has been taking the medicines for a long time, and if he did not see the improvement, and after homeopathic treatment they see the improvement, that means he should know what to stop and what to continue. Yeah.
So you like leave it to the patients. You like don't like give them guidance or commands that you have to take these medicines, leave these ones around. You give them freedom to choose.
You know, all those patients, they are very wise people. They understand everything, and I think they themselves they feel good, and they continue with homeopathy.
Okay.
Yeah.
We'll pick it from there, doctor. I want to know, do you maybe have laboratory services? Do you practice surgery?
Okay, we don't practice surgery, and we don't have lab, because most of the patients, when they come to us, they have gone for so many lab tests and they have tried those things. They bring the lab reports to us. And another thing I want to say some that uh, lab test, uh, testing somebody's sputum, somebody's blood, somebody's X-ray scans, sometimes they don't show the real problem. Because you might have seen people go for these tests and they are told you don't have a problem. Test is normal, X-ray is normal, scan is normal. So if these things are normal, then where the problem is? Because there are a lot of problems in human body, still doctors do not know exactly what is the cause behind their problems. So taking medicines, when those medicines are not working, people feel tired. People feel they will live with their problems or they die with their problems. And like for example, allergies. Allergies, people are told that these cannot be cured. But we have treated allergies very successfully and people, they feel better. Allergies, like maybe there are people, they're having asthma, they are having sneezing, they are having flu, running nose every now and then. And with the homeopathic treatment, when we treat those people, maybe somebody suffering from asthma, bronchitis, he can go in the cold weather, he can go in dusty place, and you will see his chest is not getting blocked. So homeopathy boosts the immunity of the person who was getting sick every now and then. After the immunity is boosted, he does not fall sick that frequently. So even allergies and so many conditions which are incurable can be treated with homeopathy, can be cured with homeopathy.
You have talked on asthma, and I would like to ask Doctor, on conventional medicine, they say asthma is like a lifetime treatment thing, they will treat you for the rest of your life. What about homeopathic?
So, the problem is here. You are talking on behalf of, the knowledge you have is about conventional medical system.
Yeah.
But I'm sure if you would have seen the people we have treated and we have cured those ones with allergies, with asthma, you will be surprised. There are people, they have difficulty in breathing.
Yeah.
Very little work they do, even if they walk little distance, they start getting tired. Their heart starts beating fast. But after homeopathic medicine, these people, they become stronger and they can, without feeling tired. And these medicines really, they work on those asthmatic conditions. And I want to tell those people who have, who think that their condition is incurable, they should come to our to our clinic and talk about their condition. Then they decide for the medicine, if they want medicine or they don't want. But they should not give up. They should come and talk to us so that they can know if there is any medicine for their condition. Yeah, so they should not give up.
So what's the duration, maybe if I can ask of on treatment?
There is no doctor who can predict. Like older age or younger age, somebody's how deep-seated problem is, how chronic problem is. There are so many factors behind those things, that how fast somebody will heal. So I don't want to predict anything, and there is no doctor who can predict anything. You might have seen somebody will tell you, take this medicine for 1 week, utapona. Lakini, it does not happen. So prediction, I don't think we can predict about. Maybe somebody can heal faster than the other patient. So there are no hard and fast fixed, I mean, or a fixed period somebody will take the medicine. Somebody can heal faster, others can take longer time as well. So it's not about how long somebody will take. Yeah.
So maybe I can ask, Doctor, there is also a very sensitive issue, especially when we talk, maybe I talk on side of our young people, and that is called drug abuse. How do you deal with it?
I tell you, some drug addiction, drug abuse, it's really very serious problem nowadays.
Yeah.
And Nakada is working hard on it. But one part is missing there. That is homeopathic medical treatment. You know, people, they go to rehabilitation centers 3 months, 6 months. When they come out of rehabilitation centers, you might have seen there is big number of relapse cases. Means people, they take those treatments in rehabilitation centers, and they join drugs again when they come out of rehabilitation. So we have the medicine for alcohol addiction. Wale wanapenda kukunywa changa, kuvuta bangi, eating mira, taking other drugs as well. So with homeopathy, we treat somebody's craving reduces. If somebody has got withdrawal symptoms, like maybe trembling hands, maybe somebody emotionally imbalanced, shouting, screaming, somebody is irritable, getting angry for no reason, crying at small things. We treat their conditions so they become okay after that. And I believe for drug abuse, for conditions like somebody who has been trying to stop taking alcohol, with homeopathic medicine, these patients have stopped taking alcohol. People who have been smoking cigarettes, a whole packet or more than one packet in a day, we have treated very easily. And they stop smoking cigarettes as well. Yeah.
Immediately or?
Oh, not immediately, because we don't have a magic stick. You know, medical treatment is a process.
It takes time, yeah.
It's a process.
Yeah.
But homeopathy works much faster in stopping the craving of somebody's drug addiction. Maybe it can be alcohol, it can be smoking cigarette, or any other drugs as well. And it can work very successfully.
Are there medicines that maybe we can give to somebody who maybe is not yet addicted, but he is maybe almost? Are there maybe medicine that can prevent?
Why somebody has to take the medicine when somebody is not suffering?
Because they say prevention is better than cure.
No, that is another fear now. That fear, I will indulge into this thing. We should not have fear. If somebody is not involved, or somebody who has not been taking these drugs, he should not be worried. You know, why taking medicines? I don't think somebody should take medicine before he is sick. Preventive medicines, I don't think. You know, somebody who is in his sober mind, that alcohol is not that good, or maybe smoking cigarette can cause cancer. Why, or maybe chewing tobacco can cause cancer. When there are people, they don't even touch these things. They don't take these things. So we should not worry about those who are not taking. But the ones who are taking these substances, It can be alcohol changa, or it can be even lot of beers, or maybe even heroin, cocaine, and all sort of substances. There are different medicines for different conditions. So I believe somebody who are addicts, they should definitely try homeopathy, so that the way they are feeling that addiction cannot be treated, cannot be cured, it is curable condition, and it is a medical condition. It is a medical condition. They need medicine, then they feel okay.
Doctor, I think I will ask how.
And there are there are different reasons behind taking why somebody is taking alcohol. Okay.
Why you may take mira, why you,
somebody taking alcohol maybe just to have fun, or somebody is taking mira because he is depressed. Taking alcohol because he is depressed. So there are medicines. We cure his depression. He will stop even the other side. I mean, taking alcohol. So we have to work on what is the reason behind those conditions, the root cause.
And how, if I can ask, how do you know what the root cause?
Oh, patients always tell. The addicts always tell, or maybe the family members they tell that he started taking alcohol maybe after something, some trauma, something happened in life, and then they started taking. Or he started in student, I mean, while he was in school or college, and now he cannot quit, peer pressure. And we have medicines for peer pressure. You know, why somebody has to follow? If one is doing wrong things, why you have to do wrong things? That means your willpower is not strong enough, and you are just following him. That's not good.
So you give medicine that increase your
willpower.
Your willpower.
Willpower as well. Yeah. So the medicines are there, and they do work.
I think now I can ask the question that I wanted to ask. That doctor, you know, when you talk of drugs and drug abuse, it is a very sensitive issue in Kenya. So my question was, is there any way that this information maybe can get maybe to Nakada, or maybe to rehab owners, maybe to churches, and maybe you can try to tell them that this thing is curable?
You know, some people are scared of losing their business maybe. If I can say what is our success rate in treating alcohol and drug abuse, it's very high, and we are very satisfied. And I believe people should try homeopathy. We are trying working with Nakada as well. And you know, there are always policies, guidelines, government policies, and a lot of stuff like that. In Kenya, our conventional system is not putting alternative medical system. There are some reasons behind it. I don't want to talk on TV. What I mean, if it is worked in India, if it is working in India, why these things cannot work in Kenya? Why there is delay in adopting homeopathy in the medical system? My request is to our Ministry of Health and our government that this system is very effective. It should be in the streamline so that people can get benefit and feel healthier after homeopathic treatment. So it should be there as well, so that people can use.
You know, doctor, a question coming in from our viewer who is asking that, you know, that a lot of our patients are coming out of Kenya to India for treatment, and he was asking me if this homeopathic system is the one used in India, maybe to treat our people who are prone to India.
I tell you, there are so many conditions. People use a lot of money. They do harambes because the bills are too high. I think before they go for such big medical treatments, you know, a patient has the right for second opinion. A patient should always try and ask a homeopathic doctor as well, and try homeopathy before they go overseas for a treatment, any country. They can try homeopathy for few days. If it is working, well and good. Otherwise, they can go and get treated even in whichever country they want to go. But homeopathy is very effective, no doubt. Yeah.
Okay, Doctor, I also think maybe you can touch and highlight some of general issues and general maybe problems that you treat.
Okay, like we have got very good medicines for diabetes. We have got very good medicines for hypertension. You know, it is to try. Before you try, you should not neglect something. You should not reject that this medicine is not good. Problems like high blood pressure, hypertension. If people are told that high blood pressure is incurable, with our medicine, because 95% cases of high blood pressure, they are mental related. Maybe somebody is angry, somebody is very irritable easily, somebody has got fear, somebody has got anxiety. Blood pressure is because of those mental problems. We treat their anger, blood pressure finishes. We treat their anxiety, they don't feel that blood pressure. So it's high blood pressure is curable, even low blood pressure. With homeopathic medicine, you don't have to take the medicine rest of your life. Try homeopathy. And other conditions, maybe I can say stroke, paralysis. We treat children with a disability. Disabilities like cerebral palsy, autism, Down syndrome. They are very good results for children with disability as well. And people, I mean, those who are not able to stand, I mean the children, their legs became stronger, their neck became stronger, mentally slow learning people. They go to schools and the marks are 20%, 30%, C, D. So with after homeopathic treatment, they become normal, more brilliant, and they get better marks. And because their grasping power becomes better. So when whatever teacher teaches, these children, they can get it easily. Learning becomes easy. The learning which was very slow, it improves the learning as well. So there are different medicines for learning slow learners as well, and we do treat such cases. Yeah.
So, Doctor, we are coming to the end of our show, but of course, before we end, I wanted you to use this camera, our camera to hear, and you can talk to our viewers, and maybe you can tell them on why they should prefer homeopathic and less other system of treatment. You can feel
okay, I can to the viewers. I will say, okay, maybe just something small about ladies' problems. We can treat so many conditions, gynecological conditions, which somebody, okay, maybe there are those ladies who have got stomach, abdominal cramp before period. And with homeopathic medicine, they will not need taking painkillers every now and then. They can be treated easily. Ladies having heavy bleeding during menstruation, heavy bleeding can be treated as well without going for surgery. It can avoid surgery. So there are ladies' problems can be treated, infertility and so many other conditions. And I believe the way this system it works, people should try. If you are told that your condition is incurable, don't lose hope. try homeopathic treatment. I'm sure you will get improvement, and it will work. Yeah.
So I think, Doctor, you will help us by giving direction to our clinic to our viewers.
Okay, our clinic is at SGSS Khalsa Center. There used to be a Khalsa school, which is very near ATG Deliverance Church. And the name of the clinic is Brain Dynamics Clinic. Brain Dynamics Clinic is not treating only brain, so don't be scared. We treat physical problems and mental problems. Physical problems also we treat very successfully. So I believe homeopathy works, and don't give up.
And it can work for our viewers too.
Oh, definitely, why not? For everyone. Yeah,
Maybe you can give them your contacts.
Yeah, our phone numbers are 0722 722 105. 722 722 105. Yeah, 0722 722 105. So that is the phone number.
Maybe you can repeat it again, that will get it.
Our phone numbers are 0722 722 105. Yeah.
Are you on social media? Maybe Facebook, Twitter?
Yeah, website or something?
Yeah, do you have maybe a website?
Yeah, website is there as well. That is www.braindynamicsclinic.com.
Thank you very much, Doctor, for coming through. We appreciate you.
Thanks a lot.
Thank you. That's the end of our show. I've been your host, Sassam, and it was just amazing on getting knowledge on homeopathy from Dr. Narinder. So catch me next Monday. We'll be in for yet another episode of Youth Care Unit. I've been your host, Sassam. God bless you.